future of healthcare has arrived. Artificial intelligence and machine learning are transforming the practice of medicine and improving patient outcomes. This is Smarter Healthcare with AI. Conversations with Dr. Hassan Tetteh as he shares insights into the healthcare of tomorrow and how we can help create it today.
Today, I am so pleased to welcome Dr. Ritu Agarwal. She is the William Polk Carey Distinguished Professor and the co-director of the Center for Digital Health and Artificial Intelligence. Dr. Agarwal is a renowned expert whose work bridges the gap between social science, data science, and technology. She has dedicated her career to harnessing the power of digital tools to improve healthcare delivery, promote equity and access, and ultimately save lives. But Dr. Agarwal's accomplishments extend far beyond the research lab. She is a passionate educator, having shaped the minds of countless future leaders across a range of academic programs, a champion for collaboration. She has co-founded the Center for Digital Health and Artificial Intelligence here in DC and beyond. It is a distinct pleasure to welcome Dr. Agarwal to the podcast, and I will have to also share with the audience a personal anecdote. I have had the opportunity to meet with her over the last few months, if not year, and learn from her and truly can attest to the fact that she is indeed shaping the minds of countless future leaders. And I like to count myself as one of the fortunate among them. So welcome, Dr. Agarwal, to Smarter Healthcare with AI.
Thank you, Dr. Tetteh, and I'm going to shift to Hassan for the rest of our conversation. I truly appreciate that very kind introduction. You said a lot of very nice things about me, and it's been a journey that has sort of characterized my professional career as well as my life right now. And you're right, I am truly passionate about what I do. So I'm happy to speak about this with your listeners on your podcast.
So I came to meet you through the Center for Digital Health and Artificial Intelligence. So not only are you one of the co-founders for this great initiative, but you have truly sort of bridged this gap between the social sciences, data science, and technology. And, you know, a lot of our conversation has been around AI. And of course, this podcast is called Smarter Healthcare with AI. But what inspired you to be interested in this sort of cross-section of social science, data science, technology, and healthcare?
If you look at the history of healthcare, you know, we have had a long history of innovations that are potentially life-saving, but they've failed to gain traction in the marketplace. And I'll give you a couple of examples. Think about direct-to-consumer DNA tests. You know, since the Human Genome Project, the cost of sequencing the genome has fallen dramatically. And now it is affordable for people like you and me to go get our genome tested and to get a full map of our genetic makeup. Unfortunately, there are many people who are still hesitant to do that. Some are afraid of the discovery of a genetic abnormality that will cause them to be penalized by insurance providers. Others are worried about learning about a specific high risk that they may have for a disease. Others simply can't afford testing. And then, of course, we have the widely publicized reports of data breaches, such as the one experienced by 23andMe. The second quick example comes from our work with the National Institutes of Health on HIV prevention. You know, pre-exposure prophylaxis technologies that basically prevent HIV before it occurs have not been adopted by young people in sub-Saharan Africa, despite their proven efficacy. So why is that the case? So where I'm going with this is that we label these types of problems in healthcare as wicked problems. These are problems that are difficult, sometimes impossible to solve because information is incomplete, contradictory, requirements change. There might be many different solutions instead of a single solution, and there's a lot of complexity. So the solution to addressing these systemic challenges that have characterized healthcare for decades doesn't rest with any one single discipline alone. So to fully realize this promise of the digital transformation of healthcare and what technology can do, we must address every piece of the complex puzzle. So that is why I chose to combine my expertise in data science, in technology, with my understanding of social systems, with my understanding of how people behave, how societies behave, how organizations behave, to say, if we're going to develop tools and technologies that are potentially life-saving, there's a long road from bench to bedside. And you know that well yourself, right? So this combination of social science, data science, and technology, this type of interdisciplinary work, building communities of scholars and research teams who can get this holistic understanding of this very complex problem, that's why I chose to bridge this gap.
Wow. Well, thank you for doing this work, because as you were talking and giving your examples, I couldn't help but think about my own experience in my discipline of surgery. And there are two things that come to mind within surgery and within, sort of healthcare writ large about this gap that you talked about, where there is a technology that certainly has promised and has demonstrated a utility and a efficacy and a benefit, but takes a long time for adoption. And the factors are multifactorial in terms of why that happens. So the two things that come to mind right away as you were talking was the stethoscope. So as a heart surgeon, we carry around our stethoscope. Now, of course, there's lots of other technologies, but the stethoscope is a pretty good utility. It's very useful. As you know, the inventor of that device a long time ago demonstrated it worked very well, Linnaeus. But yet it took 30 plus years for widespread adoption. And people are just like, well, why? And, there are lots of reasons for that. The other thing that comes to mind right away is Lister. Dr. Lister was a British surgeon, advocated washing hands.
Yes, I know that story. Yep. Pretty amazing, isn't it?
Yeah. It took another 30 years, almost on average, too, for that to be widespread adopted. I have, I know I'm not wearing it right now, but my blazer has the buttons down by the wrist, and those are called a surgeon cuff. And the reason why is because surgeons in the old day used to just roll up their sleeves and go from one case to the next. They were more concerned about getting blood on their jacket than washing their hands and the humors and all of the bad things to the next patient. Yeah. So I have to say, beyond being grateful that you are basically devoting your career to this work, where does one start to really bridge that gap? And of course, it's a bit of a rhetorical question because I've been the beneficiary of your teachings and the forums that you've convened to do this. But how does one put it into practice? Because as you mentioned, there are so many social aspects to the adoption of technology, the administration of healthcare, and the adoption of new technology when it does become, available and show promise.
Yeah, that's a difficult and thorny and knotty problem, Hassan. The only way to go about doing this is to build, as I mentioned earlier, these multidisciplinary teams of researchers. Now, you run into a problem here, which I'm sure you're very familiar with, and that is the way that academic incentive systems and academic advancement occurs. And, traditionally in academia and for the entire research community, we always progress within our disciplinary silos. But I am fortunate to be at a university like Johns Hopkins, where we not only talk about multidisciplinarity, but we live it. So we have, incredible healthcare assets across the entire Johns Hopkins ecosystem. And I have been successful in being able to have these discussions with my colleagues in other programs like computer science, like bioethics, like, medical anthropology, to say, look, if we are going to take this digital transformation of healthcare and truly get it to produce some value for us as patients and for society as a whole, and one could argue for the globe as a whole, we simply must start working together. And, I'll be very candid. These are difficult conversations because we speak different languages. I mean, you're a clinician. If you and I sat and chatted for 6 to 8 hours, I'm sure you would use a lot of words that I would not understand because I don't have an MD degree. Likewise, you probably don't have a PhD in computer science. So I may end up using a lot of words which you don't understand. So there's education, there's a willingness to collaborate, a willingness to cooperate. a willingness to be vulnerable to admitting you don't know something. But it is extremely gratifying because at the end of the day, even if you manage to produce one solution that can go all the way from the lab into the hands of the people who need to use it and truly help the lives of patients, and I count myself in that community, then you feel that it's been worth it.
Well, you touched on a number of things, the collaboration across the silos in academia. You can write many, many textbooks on that. I'm sure anyone that's been in an environment of an academic institution or a student themselves, and certainly if you're a professor or staff at one of these institutions, can attest to some of those challenges. But when you call yourself, and you are truly a champion for collaboration, you have to have a bit of optimism, I believe, to go against sort of the ingrained culture of academia. And how have you been able to be successful in doing that? Beyond the things that you mentioned, what practical tools and initiatives have you put forward to make those silos sort of disappear? And you're fortunate, as you mentioned, at Johns Hopkins, because it is such a collaborative place.
But there are a number of tactics sort of on the ground, right? One is to use whatever power and influence and social capital you have to try and persuade academic leaders that this is important work, right? And once you can persuade academic leaders, deans and chairs and provosts, then you will have an incentive system that is geared to reward those kinds of behaviors. That's a lot of the groundwork that I've been doing over the years. The second is to set up structures, to set up roles and processes where you can engage different kinds of people with different backgrounds and different areas of expertise together by bringing in resources from outside. So, for example, at my center, we have a lot of funded work from the National Institutes of Health, as well as from corporations. And anytime I get a new project, I say, all right, what kind of team can I build and how can I incentivize them to work on this problem together? Mm-hmm. So you have those carrots that you can offer people. And once they get engaged with the work, they discover that they really enjoy it. A third tactic is, as you know, academia is defined, success in academia is defined by what you publish, where you publish, and how frequently you publish. So I always encourage my students as well as my collaborators to say, all right, we can publish in the top journals in medicine. We can also publish in the top journals in your discipline, which is computer science or whatever else it might be. Mm-hmm. So I think when you bring all of these things together, it's probably an easier sell to collaborators. Sure. But, you have to remember that I've spent 2.5 decades doing this. I'm at that stage of my career where I can afford to spend the time in building these institutional structures and mechanisms. For a lot of junior faculty, I just try to make it easier for them to produce high-quality research by giving them great data and interesting questions, and then, let them progress in their careers.
Yeah. Well, there was a bit of a leading question because I want us to talk a little bit about the Center for Digital Health and Artificial Intelligence that you are the co-director of. And it sounds like, in your career, you've had the opportunity to visualize and understand and appreciate how important this collaboration is. But I can already tell just from the engagements I've had with you at Hopkins that you have a tremendous amount of relationships and you've fostered building those relationships over the years. So, yeah, right. And with that, what are your primary goals right now between the researchers, the policymakers, the students in and around the Center for Digital Health and Artificial Intelligence at Hopkins?
So my journey started back at the University of Maryland, where in 2005, I established the Center for Health Information and Decision Systems, and we were conducting research and outreach of the digital transformation of healthcare. So I built my partner network at that point, and the partner network has been so instrumental for the last 2 decades in helping me do the kind of research that I want to do and have the type of impact that I was seeking to have. So the partner network provides value in 3 different dimensions. First is they give us, the really critical research problems that they're facing. So for a startup, it might be what's the business model for my new product. For an established company, it might be how do I position this product in the market? How do I get it incorporated into clinical workflows? How do I make sure that hospitals and physicians or whoever my target audience or target population is actually going to use this when it goes into the field? The second way in which our partners help us is by giving us access to data and field sites. So as a scientist, I want to do evidence-based research, and the only way I can do that is through very careful and rigorous analysis of data and carefully designed and constructed studies. So we need partners who are willing to give us access to both data as well as their sites to conduct the research. And then finally, I think our partners have been extremely helpful in working with us to train the next generation of digital health experts by offering students internships or providing financial support for graduate students and so forth. So this network is something that I brought with me when I moved from Maryland to Hopkins, and I continue to build it out. The only constraint is bandwidth. The constraint is not interest. There's only so many partners you can handle and work with at any one time.
Wow. You are well ahead of the trend because, as you know, there are centers of excellence now in healthcare all over the place, right? Mm-hmm. The Center of Excellence in Orthopedics, Center of Excellence in Cardiovascular Health, Center of Excellence in you name it, right? And that's a relatively recent trend, but you certainly were pioneering that well before. And I can't help but think of an African proverb that I've used many times before, and I think it encapsulates what you are describing, where it says that if you want to go fast, go alone, but if you want to go further, go with others. And I believe, as you have just articulated, that when you do research with others and you collaborate, and you certainly do it in the construct and in the form of a center, your results and the information that you get in terms of insight from the data is going to be far, far greater than, you could ever achieve as an individual.
Yeah, well said, Hassan, and I will remember that proverb.
So when you think about the impact of the centers that you founded, and certainly the current Center for Digital Health and Artificial Intelligence, what are your hopes, aspirations, and what are some of the early wins so far for the centers that you've founded in the past and the current one that you're leading now?
I have a lot of hopes and aspirations. Let me kind of start with giving you a big picture of what's the mission of our center here. Right? So we are an academic research center. So our number one mission pillar is to produce high quality research and important findings that are going to help us address the systemic challenges with healthcare. So, right, that's number one. Second big mission pillar is, sort of policy outreach and helping our legislators and policymakers make decisions that are based on facts, make decisions that are based on evidence. So, advocating, lobbying, discussing, presenting our findings, and helping move that needle forward because, this is so new that everybody's struggling with it. All of this AI stuff it's a tsunami that's catching the world by storm, and we are taking baby steps every day. We want to be able to help this AI baby grow up to be a mature adult. And the third piece of our mission pillar is education, education across the entire spectrum of learners, from undergraduates to graduate students, PhD candidates, but also executives and also policymakers, right? So we have programs, master's programs, MBA programs, PhD programs, and executive education programs that help us train the next generation of, I don't even just want to call them, digital health experts. I want to call them lateral thinkers, right? Those who can also think in those multidisciplinary ways that I spoke about. So, what are my hopes and aspirations? My hopes and aspirations are that we continue to produce research that gets published in the best possible outlets. And that addresses, and it's not just about doing the research and publishing it, but that addresses, some of the really big problems that we're facing. So, I'll give you an example. Precision medicine is sort of on everybody's mind right now. It's such an attractive concept and it's such a powerful concept. But we know very little about how to deliver precision medicine, right? We talk a lot about it. We have incredible collections of data that we can apply machine learning algorithms to. But in a nuanced way, what exactly does it take to develop a precision intervention? And, I'm not a biomedical scientist, so I'm not interested in that aspect of precision medicine, but I am interested in precision digital therapeutics, if you will, right? So these are software tools that are predicated on AI to be able to provide the right intervention, the right information to the right time to the right patient. So we have a lot of ongoing work in these precision interventions, and both are in collaboration with companies. So we're extremely excited about that. One is in the domain of diabetes, and we have some models. I can't talk a lot about them, but we have some models and some results that, at least in my mind, can use this amazing data from sensors and wearables in a very powerful way to help us manage this condition that afflicts, millions of people worldwide and costs billions of dollars in the United States alone. So that's one area that I have a lot of hope for and excitement about. A second area, again, related to precision interventions is about, when was the last time, Hassan, I'm going to ask you a question here. Mm-hmm. When was the last time you got a prescription from a doctor?
Just 2 months ago.
Okay. So, you went through your usual routine of going to the pharmacy, filling your prescription, taking your meds, and I'm sure you were compliant. Right? But you probably know the data better than I do, but medication non-adherence is a huge problem.
Huge problem.
So we have a lot of people who will go to the pharmacy and not pick up their prescription or not go to the pharmacy at all. And then there's a knock-on effect with all these non-compliers, as they're called, those who don't fill their medication prescriptions. And the knock-on effect is that they're obviously not going to take medication that might be helpful to managing their medical condition. They might incur a lot of additional healthcare costs, and they might suffer from some really bad adverse outcomes. So this project is focused on applying deep learning predictive models to enhance our understanding of the individual patient. Can we look at their demographic profile? Can we look at their psychographic profile? Can we look at their potential needs and interests? Can we use all of these data to understand when we should send a message to this patient, when we should intervene, when we should give them some kind of discount on their prescription, and when we should remind them to pick up their prescription? So these AI-driven actions, include determining the most effective timing for sending messaging, crafting the message content for maximum impact, and then optimizing the user interface displays. So this is another digital therapeutic intervention project that we're very excited about. So let me go back to your big question here. Mm-hmm. Hopes and aspirations. Mm-hmm. Hopes and aspirations are that this will transform diabetes care, that this will improve medication adherence by leaps and bounds, or at least by a few percentage points, which would be huge as well. So let me pause there and let you ask me the next question.
Sure. So what you've done is you've elaborated on how AI fundamentally can help in predicting healthcare outcomes. I mean, intervene on affecting and impacting those outcomes from patients, particularly in the prescription example you provided and in others when it comes to diagnostics. So when you think about predicting healthcare outcomes and this concept of precision medicine and this era that we're living in of AI, All of these things have been challenges that have existed for time immemorial, ever since we started giving prescriptions and we worried about patients' care and their outcomes. And precision medicine is fairly new. But in the advent of where we are from a technological standpoint, and speaking specifically of the data, the compute power, the investments, and of course the talent that you have helped to foster in terms of your generation of students that you bring into the discipline now. What forces do you think exist now in this era of time, in 2024, that didn't exist in the past, that will make the promise of achieving all of these things so much more possible and hopefully more impactful?
Yeah, I think it sounds trite and many people use this phrase, but, we are at an inflection point in some ways, right? And there are, as you rightly pointed out, there are, 3 intersecting trends that are creating a perfect storm of opportunity. I mean, the first trend, and, it's not really a trend, but it's been kind of going on for a couple of decades now, is just simply the availability of data, right? Goes back to high tech and electronic medical records, and then, continues with the ACA, and then, the Human Genome Project on top of that. And when you combine all of these together, we have, and all of the, regional health information exchanges that have been set up. So when you combine all of this together, we have a treasure trove of medical data that can potentially be utilized to generate value. I think the second piece of this trend, again, as you pointed out, is, you can use whatever superlative you like, but, the striking, remarkable, exponential improvement in compute capacity, and the striking, remarkable, exponential decrease in the cost of compute and storage. Right? Without those, all of this would have been unaffordable for your typical healthcare organization or healthcare stakeholder. So that's number 2. Mm-hmm. And number 3, which is, again, this has been going on for about 3 decades, but it is the advancement in statistical methods and mathematical models. And really, those are what underlie things like generative AI, right? So we've got a whole stream of scientists, a whole community of scientists that have been working on this, and they have produced some incredible outcomes. So when you put all of these 3 together, and you say, we have a robust marketplace where innovators are coming to us with new technologies that are increasingly more miniaturized, with wearables, with sensors, everything that can capture data at the point of where it's generated. The world of opportunity is expanded exponentially. So this is the perfect time. And, I would be remiss if I did not at least acknowledge the fascination that the entire world has right now with AI.
I think the large language models in ChatGPT have made AI accessible, tangible, and real for many people. Whereas before, unless you were a coder or someone steeped in computer science, AI seemed a bit fantastical or just something you'd see in the movies. But when you're able to interact with the platform, ask questions, and get intuitive answers back, it's really fascinating. I think that's what has raised the level of interest to our current zeitgeist. Okay, Dr. Agarwal, we have to stop here, but coming next time, I'll try to convince Ritu to share some advice for the next generation of physicians.
Certainly an understanding of artificial intelligence, certainly enough of an understanding of the technology to be able to ask the questions, right? Because we don't expect them, in addition to their medical expertise, to become technical expertise as well, but they should know what questions to ask their model developers and model builders.
This has been Smarter Healthcare with AI. If you'd like to find out how to bridge the gap between medical experts and tech innovators and discover how AI can make us healthier and more human, go to Tetteh.com. Smarter Healthcare with AI with Dr. Hassan Tetteh is a production of Forbes Books.